Approaching St. Paul Street, doors will open on the right. This is Coolidge Corner. The destination of this train is Cleveland Circle.
Good morning, everybody. I have a special video today. It is currently 10 o'clock in the morning on Wednesday, October 25th, and I am walking to Dr. Gresham's office. She is a dentist in the outskirts of Boston. She's a practice owner over here, and I'm going to be showing you guys what a day in the life of dental practice owner is like. So that should be a fun video today. Stay tuned and let's see what goes on in the life of Dr. Gresham. Welcome to Rooted Dental Company, located at 1371 Beacon Street in Brookline, Massachusetts. At Rooted Dental Company, Dr. Khara Gresham is the only dentist and offers a number of treatments including Invisalign, implants, veneers, and more.
In terms of pain, sensitivity, nothing like that?
Somewhat sensitivity in the ones like here,
Okay.
like the incisors.
Bite sensitive? Yeah. And so you kind of bite a little edge to edge, so that would make sense. And so if you were considering Invisalign, I think that's a really good option. It has to integrate for about 3 or 4 months, and then you get a tooth. I know, the longest process ever for your tooth, but it'll be worth it. It'll be worth it. Potentially.
Am I going to have to pay more?
I don't know what they...
This is the most expensive tooth in the world.
But it's yours.
Yeah, forever.
It is
I
forever.
hope it's nice and long.
Absolutely. I don't know what Gordon and them all told you, if they gave you the full price for everything or just the one implant
I
today.
have no idea.
I'll check.
It doesn't matter. It is what it is. Don't worry.
If it integrates really...
There are 5 operatories at Rooted Dental Company, but it is soon to undergo renovations and have 6. The dental office currently includes numerous different technologies that are growing in the age of digital dentistry, including iTero, CEREC and Prime Scan, and CBCT. At the office, Dr. Gresham aims in creating a friendly environment for her staff, herself, and her patients. If you are in the Boston area and you are looking for a dentist, I highly suggest this dental office, as there was not one person that I saw throughout this entire day that left without a smile on their face.
All right.
Okay, so I am here with Dr. Khara Gresham. For everyone that watched the video from when I spoke at the ASDA panel, this is the lovely lady that was sitting next to me. She allowed me to come and shadow and record a little bit at her office. So I wanted to just have her introduce herself and talk a little bit about why she chose to be a practice ownership, what vision she has for her practice, and just give some advice for all the dental students and pre-dents out there who see practice ownership in their future but don't, are scared or don't really know what to do or anything like that. So I will allow Dr. Gresham to introduce herself and tell you guys a little about her.
All right, my name is Khara Gresham. I'm a previous Tufts graduate. I graduated Tufts in 2014 from dental school. And I've been a practice owner for about 2 years, a year and a half. And Yeah, I'm from Philadelphia. I'm in Boston now. I guess this is now home. I never thought I would say that, but I built a career here, and it's serving me well.
Okay, I told you what I was going to ask and I already forgot.
That's okay.
Okay, so the first thing is I wanted to ask what experience you had before choosing to open your practice. I think a lot of us, when I say us, I mean dental students, but this applies for pre-dents as well. A lot of us are, we graduate and we think, okay, we don't really know anything. Also, we're super scared to be on our own because everything we do, we have a supervisor or someone we can lean on or to bail us out. So I wanted to know what kind of experience you got before opening a practice, and then after you answer that, you can say like how you felt, how you knew you were ready, or maybe you didn't feel ready and you just took that leap of faith or whatever it might be.
I will say you're never ready. There's always something you don't know. So if you're going to be led by fear, I would say try not to. I think dental school equips you really well clinically to know the things that you need to know. And whether you do residency or don't do a residency, I would just trust your clinical skills. So when I graduated, I worked at a community health center for like 3 or 4 years. And then I knew I wanted to be in a more private practice setting, do more cosmetic dentistry. So I pivoted into working at a more cosmetic office as an associate. And I worked there for like 3 years. I overlapped the years at a point. And I would recommend whatever associate position you get yourself into, make sure it's doing the things you want to do. So as much as I loved the community health center and the patients that I served there, I wasn't doing the procedures I wanted to do. So I made sure I found an office that I could, do implants. They would walk me through Invisalign. They would help me with cosmetic cases and get exposure there. The first job I worked in, I was the only dentist, so it's always scary. So I just make sure you have a network, the people that you can lean on, whether that's mentors or other classmates that can answer any questions you have. And then don't be afraid to tell patients, like, you know what, I need to assess your case, take some records, and then I can come back to you. So don't feel like pressured into anything. So don't worry about being nervous or not knowing what you need to know. I felt I was ready probably like 2019 to buy a practice, and then COVID happened, so I ended up not purchasing the practice until 2022 because the banks had stopped lending, so I couldn't, and I didn't just have $750,000 to buy a practice on my own. But once the bank started lending again in January of 22, I was able to purchase the practice. But now that I'm in it, I think I was probably ready before. I was afraid that I didn't know the business side because we don't really learn that. But you never really know it. And as long as you prepare yourself, so I read a ton of books. I, watched all the, dental people I could find on Instagram. I had colleagues and mentors. Even the people that own the practice I worked at, I, picked their brains. I stalked our office manager because, the owners know stuff. But usually if you want the business side, the office manager is who you want to get your information from.
Before I move on to the next question, I have like a new question that segues from what you said. So you mentioned about the banks lending and all that stuff, and around $750,000 to buy a private practice. So when you were thinking about practice ownership and knowing that you had to borrow money from the bank to open a practice, while we are all also thinking about how expensive dental school is and the amount of money we owe for dental school. Yeah. Did that ever influence your decision of, okay, maybe I don't want to take on more debt right now, etc.?
Not me, but as my financial advisor says, I'm not very debt adverse. There's people who are really cognizant and aware of debt, and they're afraid to get into more. But I really look at educational debt, not like credit card debt. I don't believe in that, but educational debt is something that is just we're gonna use as a stepping stone. So we're all gonna have dental school loans unless your dad handed you a practice, and you were able to pay for it that way. And you're all gonna have a practice loan. You're gonna be able to pay it off. You make way more money as a practice owner than you do as an associate. And as long as you're buying the right practice, don't just buy any practice, but one that's financially healthy, and it's already doing the revenue that you want to do, then you'll be able to pay it off. So that wasn't what was holding me back. It was more, I was like, there's people that are gonna look up to me and they're gonna ask me questions I don't know how to answer. The financial stuff, I was like, what's a P&L? I don't know what it is. I don't know how to read it. So that scared me more than just having more debt because, You know, people buy houses all the time for that much money or more, and like no one's like, oh, what about the debt? It's you know, it's just a house mortgage. It's literally the same thing. So yeah.
Okay, so the next question was, what was your reason for becoming a practice owner? Is this something you always envisioned, that you always had in mind? Why did you decide, you know, I want to buy a practice, be my own boss, and be an owner?
So I always wanted to be a practice owner. That was always like my future vision. And I always just said, I was like, oh, by 35, I'll have a practice. And I don't know why I picked that number. I just did. I thought like 10 years of practice was like enough to make me feel like I knew what I was doing. But maybe like 6 years out, I was like, oh, I think clinically I know what I'm doing. The dentists I looked up to when I was growing up were all private practice owners. So all my mentors, they have practices, and they always talk to me about what the benefits are, and like that they strongly recommend doing that over being an associate, or like working at, you know, bigger corporate offices. Yeah.
Okay. Yeah. So do you have like a vision for your practice when it comes to building your practice, building your brand, etc.? What do you want people to think when they think of Dr. Gresham's office?
Yeah, I want it to be like friendly and inviting. I want all patients to feel like they're welcome here, regardless of like age, race, you know, oral health background. I just want it to be like a friendly environment for patients, and I also want my staff to feel comfortable. I want them to feel like loved and supported, and like, you know, that they can reach and achieve whatever goals they have for themselves. And as an owner, I want to be able to like provide them with the stability of like a long-term job. And so like some offices, they have a lot of turnover. The person I purchased this practice from, most of the staff had been here for 20 years. And I think that's really honorable and commendable. And that's what I hope to have. Like staff that's been here, they know the patients by name, that we do stuff together. You know, I like to say like a little family, and it doesn't have to be perfect. There's always ups and downs, but I want it to be like, you have to come here every day. I want it to be enjoyable. I don't want it to feel like a chore. Like obviously waking up at 5 a.m. is a chore, but once you get here, I want it to be enjoyable.
Right. So you kind of grazed over a lot of advice already, but is there any extra advice that you want to share for students that want to own practices one day, or future practice owners? Maybe they already graduated and are working as associates, etc.
I would say if you want to do it, just do it. Waiting is not necessarily going to give you any more knowledge than you have, unless there's like truly a skill you don't know how to do. But what you graduate from dental school is enough to run a practice. I know plenty of people who just do bread and butter dentistry, crowns, you know, extractions, fillings. That's it really. They don't really touch on implants. They don't do veneer cases. They don't do anything big, but they're running, you know, $1 million practices. So you don't have to do crazy cases to make the kind of lifestyle you want to. And just figure out like what you want to do in dentistry and focus on learning those skills. And then, you know, when you're ready to buy a practice, I think everything will fall in place if you've done the work. Don't be afraid. It's always scary. Everything's scary. Every day's scary. I'm getting ready to renovate and I'm terrified. But I think if you're not challenged and you're not afraid, then you're not like working at your full ability. So,
would you mind touching a little bit on like renovating and your kind of what made you want to expand your practice, and what ideas you had as far as that? Kind of just like why? Yeah,
well,
especially
why?
so soon, I guess, since you opened in 2022.
Why? Because I want it to look a certain way, and it does not. And I just, you know, when I come in here, I want it to be like what my vision was. I don't want it to be like crazy fancy or anything like that. I just want, you know, things to work and everything to be streamlined. And I don't want to worry about it in the future. I'd rather get it done now and then just have the practice how I want it, versus, you know, 5 years from now going back. Also, because a lot of the newer equipment that I want to get, it just requires the electricity to be better than what it is. And yeah, I want, you know, I have like a certain goal and vision in mind that I want to just get to. So
cool. For the people that are watching the video, is there a way that they can follow your social media or get in contact with you? Maybe they want to book an appointment, or they're looking for mentors or whatever it might be.
Absolutely. So you can always call our office at 617-566-2734. My Instagram is Dr. KG. It's DrKaygee. DM me, call the office at any time. And my email is my first dot my last name @gmail.com. Yeah, I always love having students shadow. I think dentistry is like the best profession. I would 100 times over go back and do it again. So if you don't think that, I would love to try to change your mind.
There you go. All right, thank you.
Thank you.
All right, so before I close out the video, I didn't have the proper transition to find a way to really fit this into the video, but I wanted to show y'all some of the things that I got to see while I was at Dr. Gresham's office, including how she communicates with her patients. I watched her do a new patient exam, also watched her place an implant, so I'm gonna include some of the stuff from that before I close out the video. I'm recording this right now as I edit because this is really the only time that I could just come and say something before I transition to those clips. So keep watching to see some of that stuff happen, and then I will close out the video afterwards.
In terms of pain, sensitivity, nothing like that?
Somewhat sensitivity in the ones like here,
Okay.
like the incisors.
Bite sensitive? Yeah. And so you kind of bite a little edge to edge, so that would make sense. And so if you were considering Invisalign, I think that's a really good option. Especially, I noticed on the skin there's a little bit of plaque and calculus buildup, like in those ridges there. So that also helps you keep it nice and clean, right? Tell me about brushing and flossing habit.
I have the little floss thingies, the big thingies. I use those a lot sometimes. And I brush like once, twice a week.
Okay. When you brush once a day, is it morning or night?
In the morning and then in the night.
Okay. I would say if for some reason you're only doing once a day, try to do the nighttime, just because everything you eat is ready for the day. It's better to brush it off. With flossing, the picks, they work if that's what you're comfortable with. I would gently urge you to move on to the floss. It does. So that is kind of the floss that you use. Going fine there. You okay? You're almost done.
Good.
I'll trade places with you.
Say what's about that?
You've done all the hard
Did
stuff.
you leave it? No, it wasn't that bad.
So that was pretty cool. If you're in the Boston area, I definitely recommend you go check out Dr. Gresham's office. Very nice staff, very nice dentist. I feel like when you walk in, you feel welcomed. And she is very good with how she communicates with patients, explains to them their treatment and what is to come in their treatment plan, etc. Which is super important. As we've been learning in dental school so far. Patient communication goes a long way. It's important in helping establish your practice and build your rapport with your patients. And Dr. Gresham does a great job at that. So if you're looking for a dentist in the area, if you're a student looking to shadow, etc., go check Dr. Gresham out in Somerville and you won't be disappointed. That's all for today's video, and I'll see y'all in the next one. Peace.